Musculoskeletal ultrasound is an emerging technique with clinical uses for the trauma and hand surgeon. Small parts ultrasound evaluates muscles, tendons, and bones, and can be done rapidly by the surgeon. It requires special skills, but ultrasound can also evaluate the wrist, shoulder, ankle, and the joints and bursa. Ultrasound provides a means to rapidly identify fractures of the long bones, ribs, metacarpals, and metatarsals. A generous amount of gel is used for musculoskeletal ultrasound. This helps to reduce the amount of transducer pressure for the examination. The scan is done in a longitudinal fashion over the injured area and slowly translated over the bone. Normal bone appears as a fine hyperechoic line. It's important to keep the transducer perpendicular to the bony surface to make the image as crisp as possible. A fracture will be seen as a discontinuity in the bony surface. It will have a surrounding hypoechoic fluid collection, corresponding to the fracture hematoma. The contralateral bone is scanned as a normal control to confirm the fracture diagnosis. Ultrasound can also be used during fracture reduction to demonstrate adequate reduction before operative fixation or casting. This technique can reduce the number of confirmatory X-rays necessary to achieve an anatomic reduction. Ultrasound is also a reliable technique for metacarpal and metatarsal fractures. Placing the injured hand or foot in a water bath allows excellent visualization of the bones. Using water also avoids the copious gel necessary to allow adequate probe contact in this location.